Hey guys, Dr. Bodle here, and today I wanted to talk about why thyroid medication isn't always the most helpful for people who are in the early stages of Hashimoto's. Now, if you've watched my videos before, you know that I think that we shouldn't talk about Hashimoto's or autoimmune conditions as something that is off or on. Instead, we should always consider it as a progression. Autoimmune conditions develop because of three primary factors. The first is a genetic predisposition towards autoimmunity, meaning that there are likely other people in your family who have autoimmune conditions. The next is a breakdown in our immune system and immune barriers. This can include things like our gut, our lungs, our skin, or our brain barriers. And the third is an initiating event, something that places enough of a stress or inflammatory load on the body that it disrupts the normal way that your immune system works. Once those three factors come together and we trigger that autoimmune activity, we can then see the development of antibodies for our own tissues and proteins, leading to damage, disruption, and the impairment of function of that particular system that is being targeted. With Hashimoto's in particular, the target proteins are enzymes within our thyroid gland that help us to build and form thyroid hormone. These antibodies, in concert with changes in regulatory immune cells and changes in T cell activity, can cause us problems in two different ways. The first is the more standard way that thyroid problems are assessed and regarded, and that is that eventually, with enough autoimmune damage, our thyroid gland is going to be damaged to the point where it can't produce thyroid hormone in a healthy and normal way, and we will start to see those levels drop on our lab values. This drop in T4 and eventually T3 is most commonly signaled by an increase in TSH. When our brain sees those thyroid hormone quantities start to dip, it tries to compensate for that by increasing TSH. TSH is the hormone that our brain releases to stimulate the thyroid gland, and if our thyroid isn't producing enough of what it should, then our brain is going to try to do everything it can to get those levels back up to normal. The thing is, these big changes in lab values, the low T4, the increase in TSH, are long-term effects of Hashimoto's, and for most people, they won't see them show up for months or years after the onset of their initial symptoms. This is why we need to keep in mind that autoimmunity is a progression. And although it can lead to those dramatic and significant changes, as I said, they're not the first thing that can happen, and more importantly, people can struggle with symptoms for a long time before we eventually get to that point. But if we haven't been diagnosed with overt autoimmunity and clear indications of hypothyroidism, what's the other way that the development of antibodies and changes in immune system function can lead to changes in how we feel and how we function? Well, in the early stages of Hashimoto's, before we see changes in TSH and T4, and before we necessarily see changes in special imaging like ultrasound, we can still struggle with what we would call autoimmune reactivity or subclinical Hashimoto's hypothyroidism. At this stage in the disease, antibodies and immune dysregulation are present, the patient is still experiencing symptoms, but we don't have all of those late stage changes that most doctors are waiting for. That way they can definitively say that this is Hashimoto's hypothyroidism. This can be confusing for a lot of people because they know they have these abnormal tests and positive antibodies. They know that they don't feel well, but their doctor isn't really giving them confirmation of what they should do next. So why is there this disconnect? The reason is because most doctors are trained to address thyroid issues with one strategy, and that strategy is thyroid hormone replacement medication. Now, more traditional doctors will typically use something like Synthroid or levothyroxine, which is a synthetic form of T4, and more natural or holistic doctors tend to use something like Armour or other forms of desiccated thyroid that contains both T4 and T3. Of course, you'll always find exceptions to the rule, but in general, that's what most patients are going to experience. However, in the early stages of Hashimoto's, people are experiencing symptoms not because their thyroid gland isn't making enough thyroid hormone. Remember, at this stage, their TSH and T4 are still normal, and that means even though this autoimmune activity is going on, there hasn't been enough damage yet to cause an interruption in that T4 production. This means that someone who's having low thyroid symptoms isn't having it because of a quantity issue. It isn't because of a lack of thyroid hormone in their system. Instead, we know that these symptoms are a result of the tissue injury that is occurring due to our immune system and the inflammation that is associated with that injury. As I like to say, if you were to twist your ankle, you would have tissue injury to the muscles, ligaments, and tendons in that ankle that would then produce an inflammatory response. Now, an ankle injury tends to be more structural and physical in nature, but we can injure our tissue in other ways as well, and autoimmunity is one of those ways. So when we have immune system flare-ups, that damages our thyroid gland and leads to inflammation. That inflammation tends to be more systemic in nature than if we were to have an ankle injury. This systemic inflammation can then interrupt the way that our hormones, including our thyroid hormone, interact and work with our cells. And anytime we have this type of interruption, it can decrease the functionality of that particular hormone. So when someone is having thyroid symptoms in the early stages of Hashimoto's, again, it's not because they don't have enough thyroid hormone. Instead, it's because of this inflammatory immune response which is blocking the way that their thyroid hormone works. This is why medication at this point in the immune progression tends to be ineffective. The goal of thyroid medication is to help replace the thyroid hormone that isn't being produced. It's trying to fill a hole or bridge a gap for someone whose thyroid gland just isn't working properly anymore. And it doesn't have anything to do with the actual management of autoimmunity itself. Remember, although Hashimoto's is targeting our thyroid gland, it really isn't a thyroid disease in and of itself. Instead, it's an immune system disease, and therefore our focus should be on the immune system first. As we said, giving someone hormone replacement doesn't address the autoimmunity. And for someone who already has enough T4 and T3, adding to that with more hormone in the form of medication can actually make them feel worse and sometimes promote hyperthyroid-like symptoms. So do some people need thyroid medication? Absolutely, and it can be a game changer for those who it is a good fit for. But in general, that's going to be situations where the TSH is elevated, the T4 is low, and the Hashimoto's symptoms are very chronic and progressive in nature. But for someone who is in the earlier stages, has those antibodies present, but their thyroid gland is still relatively intact, then adding medication to their care plan might not make the most sense, and it could potentially make them worse. So although all of us generally have the same inclination, and myself included, that if we're having low thyroid symptoms, then the way to best address it would be to find the medication that fits with our body, we have to also assess why we're having those low thyroid symptoms in the first place and what those other thyroid markers look like. By taking a comprehensive look at all of our thyroid markers and assessing where we're at in terms of the autoimmune progression, we can then make better decisions about the strategies that are going to support us the best and make sure that we start seeing resolution with our symptoms. But I hope that you found this information useful and it helps you to better understand your thyroid condition. If you did, I always appreciate it if you can give the video a thumbs up and subscribe to the channel. And if you have any questions, you can leave them for me in the comments below. If you enjoyed some of the topics that we covered today, but know that you need someone to assess your full health and thyroid picture and provide you with a clear plan to help you feel better, and you're maybe interested in working with me one-on-one, then you can always start that process by requesting a free consultation by sending an email to contact@seattlethyroidhelp.com. Once we receive your information, my staff will reach out to find a time that works for you. Then you and I will sit down, we'll go over your health history, your goals, and make sure that we're a good fit to work together. If you'd rather keep learning on your own, you're welcome to check out any of the other videos on the channel or grab either one of my free downloads listed in the description box. The first one is one of the nutrition plans that I use with a lot of my patients who have Hashimoto's, and the other is an electrolyte recipe that I use to support people who are following a low-carb or ketogenic way of eating. But that is it for this one. Love you guys. Hope you liked the information. Don't forget to like, comment, and subscribe. If you're not doing so already, follow me on Instagram and Facebook, and if you need anything, feel free to reach out. But my name is Dr. Brad Bodle. Have an amazing week, and I will see you in the next one.